There are now 2 more confirmed cases of measles being investigated by Grand Erie Public Health. It brings the total number of confirmed cases there to 21. Simone Gavros joins us with a very large area to cover here.
Yeah, Annette, it just continues to spread, and these latest 2 cases are linked to a previous exposure, according to the health unit. So far, 5 adults and 16 children in the Grand Erie region are among the total confirmed cases. Now, this morning I spoke with Dawn Bowdish. She is a professor of medicine at McMaster University and says there are a number of factors that are contributing to the spread of this virus.
We know that childhood vaccinations stopped getting to the level we needed them to in the context of both the pandemic and the family doctor crisis. So the measles vaccine is a really well integrated part to childhood vaccination schedules, but if people don't have consistent visits to a family doctor, it's really easy to slip through that. Of course, vaccine hesitancy also plays a role. There's a lot of misinformation about vaccines, and that tends to happen when cases are low or absent. People think they don't need it anymore. And then, of course, the virus takes advantage of that and infects unvaccinated people.
Now, the following locations are the latest to have been exposed to measles. Now, for reference, you can see the Grand Erie region there in red. That includes Haldimand County, Norfolk County, as well as Brantford and the County of Brant. 2 exposure locations are in Simcoe. It was at Roulston's Pharmacy on January 28th and Shoppers Drug Mart on Norfolk Street on January 30th. The infected individuals also traveled to 2 locations in Newmarket on January 31st. It was a Best Western Hotel as well as the Magna Center Arena. Now, Bowdish says that measles is challenging to stop because the window that a person is sick without symptoms is pretty long. Measles is highly contagious and can live in the air for up to 2 hours. Now, anyone who believes they've been exposed to measles should check their vaccination records. You need 2 doses of this vaccine. Also, keep your eye out for any symptoms 21 days after exposure, including a red rash, fever, cough, as well as runny nose, red eyes, and fatigue. Anyone with measles must isolate immediately and report the illness to your local public health unit. We'll continue to be following this story and any updates that are coming out of these public regions.